Well, teachers are being added to those in line for COVID-19 vaccinations this week. Cleaners and other supporting staff at more than 25,000 public schools countrywide are also eligible. I'm joined now by Mugwena Maluleke, General Secretary of Teachers Union, Sadtu. Mugwena, always a pleasure speaking to you. First of all, is it true that indeed the Acting Director General of Basic Education, Granville Whittle, is alleged to have told unions, this was during a meeting on Friday, that indeed 500,000 Johnson & Johnson vaccines would be made available for teachers and supporting staff? Did that meeting indeed take place on Friday? And was that the commitment as per Basic Education?
Evening, Faith, and good evening to your viewers at home. Thank you for the question. I must say that it was a planned meeting, indeed, that we were discussing about the vaccination, as we have reported before, that we're engaging the department. Together with the department, we have made submission to the Department of Health, and therefore, yes, the meeting did take place, and therefore, approximately about 500,000 doses were something that the acting DG has stated, and obviously there were, condition to the report that we received. It was always going to be dependent on the Department of Health as well as the FDA. Once that has happened, then it can clear the way forward in terms of rolling out this particular vaccine to the teachers and the support staff.
Mugwena, was it articulated when and how these vaccination distributions will actually take place?
Yes, everything was presented in a very organized way, as we have been discussing it throughout this April and May, where it was going to be, if the pronouncement was going to be made by the FDA, and therefore the doses were to be available from the 5th of this month, the minister was going to be making an announcement today or tomorrow, and therefore starting from the 9th, then we would be seeing the rollout to some of the leadership of the department, as well as some of the leadership of the unions in terms of advocacy. And then after that particular advocacy, then the rollout was going to be at the level of the district and the level of the schools, where we will be using our EMIS system, which is formidable, and therefore it has got all the data that is required. In other words, it can provide, group registration or mass registration rather than individual registration, in order to cut the process of registration and all these other bureaucratic system short, so that we're then able to save the time for teaching and for education in our country, because this is very urgent, and therefore it needed to have been done in April already.
Yeah, I mean, we're referring here to the Johnson & Johnson vaccine, and you and I both know that the Johnson & Johnson vaccine is still awaiting for approval from the USA's FDA, right? So in that case, should indeed the FDA not give that approval by next week as anticipated, what happens then? Is there a communique that's going to go out to teachers as well as supporting staff saying, hold on guys, we've had to put things on hold whilst we wait for this FDA approval?
Definitely. In that meeting, it was very clear that the department will be the one that will be communicating directly with the teachers, and they will be communicating directly with all the others employed staff in our schools and so forth. So a circular was going to be sent. So if anything happens that indeed there is no decision taken by the FDA, the department is still going to be communicating with the teachers and say, look, the plans have changed, and therefore we will then be informing you again in terms of what is going to happen in terms of vaccination, because the Department of Education and the unions have agreed that vaccination for the teachers is very, very crucial, so that learning should not stop.
Yeah, and then this is going to need the adequate dissemination of information, Mugwena. You and I can appreciate that, especially on behalf of the Department of Health as well as the Department of Basic Education. And we do understand that, especially when it came to the vaccination rollout plan, it wasn't the best when it came to information dissemination. So has that word now gone out to teachers, to supporting staff at the more than 25,000 schools across the country, that indeed they're now eligible to take the Johnson & Johnson vaccine? When that vaccine will be taken, how do they register for it, as well as the due processes to follow?
Well, the registration was going to be that it's going to be done en masse. In other words, we're going to use what we call personal information that we have in our system. Is backed by what we call EMIS, because the EMIS is an education management information services that we use. It has all the information about the teacher. Last year, when the teachers were applying for their comorbidities, it was also updated so that it has all the health record of the teachers and their register and their addresses and their schools where they are going to be, where they are working. So therefore, when the Department of Health and the Department of Education agree for a rollout, it was going to be at the level of the schools and the district, and the teachers were going to be informed on the date at which they are going to be vaccinated, and therefore an advocacy program, as you say, is being embarked upon by ourselves. We've already informed all our 260,000 members by Friday that there's that particular possibility. However, it is all dependent on the decision being taken by the FDA, so that they are already aware of that and they can make their decisions whether they take the vaccine or not take the vaccine. And therefore, we, as the unions, 5 of our unions, are embarking on a roadmap where we are informing members, answering their questions about hesitations and so forth, so that they can make their decisions. So yes, it's going to be a very huge task. However, it is about saving their lives. It's about saving the future of our children.
Yeah, Mugwena, are there any of your members that are actually hesitant about taking this Johnson & Johnson vaccine?
Yes, they are those who are hesitant, and we are busy answering the questions. Some of them are beginning to understand, and then we cannot then take for granted that those that have not reached a decision, we should leave them behind. We must continue to be talking to them, answering their questions, so that at the end of the day we can see a situation where we have got a herd immunity in our country, and so that the economy can start growing. So yes, there are those that are very hesitant, but there are not so many.
And then when it comes to also the vaccine rollout program in itself, right now, you and I appreciate that it is more of an urban advantage. It's an urban advantage as opposed to a rural-based advantage. So then how do you ensure that indeed the teachers, especially in the rural areas, get the very same access to vaccination sites, to the healthcare facilities, to the vaccinations that we would see in the more urban areas?
Well, in that meeting on Friday, a plan was presented to us in terms of how rural provinces are going to be rolling out the vaccine, in terms of utilizing the offices that are there, in terms of your district offices. But obviously, the schools in the rural areas have always been the centers of our communities. They've always been used for health issues, in terms of whether people are checking eyes, whether they're checking the ear problems, and so forth, whether they're vaccinating for any other immunization. We've been using the schools. So therefore, in the rural areas, the information is going to be disseminated the same way that it would have happened in the rural area, in the urban areas, because you're using the same system in terms of your EMIS, which has got all the numbers of the teachers. The SMSs will be sent. Over and above that, the circular will be sent to the school, and the principal will then be able to present that information again to the teachers and say, on this particular day, the school is going to be expected to be ready for the vaccination, and the Department of Health will then be sending those who are knowledgeable about, counseling people, but also doing the vaccination. So the plan was presented to us.
Yeah, you keep making reference to the EMIs. Just for clarity's sake, if a teacher is just registered on the system, right, the EMI system, do they need to register on the EVDS system, which is for the general public? Or now, as teachers as well as supporting staff, do you guys not register on the EVDS system and register only on this EMI system?
The interaction between the Department of Education and the Department of Health was that let them not use individual registration. Let them use what is already available in terms of the EMIS system, because it has got all the information that is required. And therefore, the system was going to be tested in whether it is able to upload the information from the EMIS into the EVT as required, and so forth. So that we left it to the technical people to deal with. But it was not going to be required for the teachers to register individual, given the fact that the vaccine was going to be expiring around the 20th of June, and therefore time was not on our side. It's something that needed to be done very urgently, and that's why we are using the systems that we have already.
Mugwena, we'll leave it there for this evening. Thank you so much for your time. That is Sadtu General Secretary Mugwena Maluleke.